Hi, my name is Tina Tricasso, and I am the registered midwife serving the Elk Valley. As part of my job, I look after families through pregnancy, delivery, and the postpartum period, and I will be your host for this maternity tour video. When you arrive at the hospital to have your baby, you will park anywhere in the parking lot out front, and you'll access the hospital through the emergency room entrance. All right, here we are at the hospital. You've come in the main doors in labor, presumably, and we're going to go down to the nursing station, which is where you'll check in. So this is the nursing station. This is where you'll stop and check in. They'll direct you to the labor and delivery room, which is where you'll be met by one of the nurses or me if I'm the one that's meeting you here. We're just going to pause and have a look at the tree of life here that's been painted on the wall. It's a place where we let parents write their babies' names, and it just contains all the babies from the current calendar year. So here we are in room 52. This is Marissa. She's one of the labor and delivery nurses here, and she might be the first face that you see when you arrive, and she'll help you get assessed and settled. Even for my patients, sometimes she's the first person before I get here.
So I would introduce myself and bring you into one of our labor rooms. First of all, I would review your chart and get as much information about you as possible before you arrived. I'd like to know how far along you are, if you have a birth plan, if you have any risk factors, and what care provider you're working with. Then when we get you down here, I'm going to ask you a few questions about what's going on. Are you having contractions or not? Are you leaking fluids? Has your membranes ruptured? How are you tolerating those contractions? And, if you're feeling like you need some comfort measures, whether it be pharmacologic or non-pharmacologic. So some non-pharmacologic comfort measures we have balls. You can sit on them, roll back and forth, use them to open up your hips. You can put your arms around your partner. You can just bounce if you want to. We also have peanut-sized ball that women will actually put between their legs on the bed to open up those hips. So right here we have our bathroom. We have a nice big tub here that you can sit in if that is what feels good for you. We can still assess baby while you're in here. Our Doppler monitors that we check baby's heart rate, they're waterproof, so you don't have to get out. You can dim the lights, put some fake candles on if you'd like. There are a lot of supplies here that we do provide. There's pads, gowns, towels, but feel free to bring what you're comfortable in from home. So right here, you'll see our labor bed. You certainly don't have to lay in it, but it's here for you. Okay, so this is our squat rack. You can use it to support your body during your contractions and stand in a squat position. You can also use it with, say, a blanket around the top as a bit of a handle to sort of pull while you're having contractions or pushing. So there's lots of different ways that you can use this piece of equipment. You'll notice that there's some IV pumps at the head of the bed. We use those in situations where someone is getting an antibiotic, if you have GBS positive, or if you're getting an induction with, say, oxytocin, or you're getting some IV fluids. That's what we use that for. This is our Entonox tank, kind of like what you get at the dentist, the laughing gas. This is an option that you can use to help get through those contractions. It doesn't take the pain away, but it helps you get through it. It's a great option. So I want to just show you our Dop tone. This is what we use to check the fetal heart rate during labor. Most women at the Elk Valley Hospital will be using this as we do mostly low risk here. So two different methods, either your Dop tone or the EFM we'll be using to assess baby. We obviously have medications here if that's something that you want to try. We have morphine that we use generally in early labor. Fentanyl we'll use in a little more established labor, and we give those via IM, like an injection, or in your IV. An epidural, this is what the pump looks like. If you do request an epidural or need an epidural, the anesthesia doctor will come in and put that in for you. If you want to go for a little walk, you can still go to the bathroom. You're generally not bedbound. Or if you aren't feeling super strong, we'll get you to move around in the bed a lot. This is where we bring baby if there are any concerns about baby's breathing or heartbeat. But normally we just keep baby on mom and just do an assessment there. And if there's no concerns, that's where baby stays. If baby needs to come over here, we have some equipment that will assist them with their breathing. And as soon as they're doing better, we'll bring baby back to mom. And this is nice and heated for them. It's like a little sun tanning bed. So after you deliver your baby, this space changes a little bit. We'll give you a nice fresh bed, clean blankets, and a mattress topper that's memory foam, so it's a lot more comfortable for you. We'll move out the warmer, we'll move out all the monitoring supplies, and there'll be a lot more room for your baby and your partner to bond in here. So it'll be a little more comfortable for you. And I just want to show you some postpartum supplies that we provide. You can bring as much as you want of your own, but we do have our very famous mesh panties. They're very comfortable, one size fits all. You can have as many as you want while you're here. We have our carry bottles. What they are is you fill with warm water. When you're urinating, it can burn after you've delivered a baby if you have a tear or some swelling down there. So you're going to use this guy to kind of dilute the urine while you're peeing and also keep that area clean. And we have, of course, pads available to you, but feel free to bring anything you're comfortable in, slippers, robes, whatever. You do not have to wear a gown. You're going to be given a postpartum package. In here, there's tons of resources that we're going to go through together. We're going to make sure that you understand looking after your baby, car seat safety, how to register your baby for their birth certificate, and what to monitor for feeding, stool, things like that. So we're going to go through a lot of information while you're here and make sure that you're feeling comfortable going home with baby. There's also a lot of supplies that we provide. You don't have to bring diapers. We do have newborn ones here. If there's a certain brand that you prefer, go ahead and bring them, but we have, I think they're Huggies here. We have wipes, flannel blankets, but bring your own if you want. Sometimes there's not time to pack a bag, so at least you know there's the basics when you get here. This is the little cot that baby will sleep in your room. We do keep babies in the room with mom at all times, unless baby needs to come out with the nurse for a couple minutes for an assessment or something like that. And this is where you can put baby when they're sleeping and when you're resting. We have a breast pump available. If you're ending up needing one, we have, this is a hospital grade one with all the parts that go with it. We'll show you how to use it, when to use it, but we do have one available to you if you need it. And if you need one when you're discharged, you can rent one from public health. This green chair here is actually for your support person to sleep on. They're welcome to stay the night here. And come and go as they please. Sometimes there's younger siblings that need care, so they might need to come and go quite a bit. This pulls out into a bed. Like that. We'll give you some sheets and blankets, and hopefully baby lets you get some sleep. As your labor and delivery and postpartum nurse, I want you to feel cared for, supported, valued, and respected. We're here to answer your questions and take care of you during your stay here at the Elk Valley Hospital. We have a great team of care providers and nurses that are very passionate about providing this care, and we hope that you enjoy your time with us. And I also want to introduce you to a part of our team who you might see in the postpartum period. Babies often get lab work done routinely. So Ange is one of our lab techs, and she's going to explain to you what that looks like when she comes to see your baby.
After your baby's 24 hours old, 2 lab tests will be ordered on your baby. When you're an inpatient, the lab will come to your room and collect a little bit of blood from your baby's heel. The lab has a set of procedures called comfort measures, and comfort measures help reduce the stress in the baby and the mom during the collection. Comfort measures can be breastfeeding the baby during the collection or doing skin to skin during the collection. There's actually a brochure you can read and you can decide your preferences on that process. When we come, we collect 2 samples from your baby, a tiny little tube of blood that we use for the bilirubin, and then a couple drops on the card that we use for a metabolic screen. We can usually collect both samples at the same time from the same collection using a safety device. The safety device makes a tiny scrape on the baby's heel, and then we're able to just capture the drops of blood from that scrape. If you are discharged before the baby is 24 hours old, we may ask you to come back to the lab as an outpatient, and you'll follow the same process as you would as an adult getting outpatient blood work. Remember that you can also make an appointment to reduce your wait time in the waiting room for that process. Also, in some circumstances, the midwife may collect these samples at your home using the same procedure as the lab.
Okay, so now we're going to move to the operating room, and in the case of an emergency C-section, we'll go through a door that's right in the hallway, and I'll take you there now, and we'll meet Melissa, the patient care coordinator for the OR. You need additional attire in the operating room, including a hat, some booties, which I'm not wearing, and then a eye coverage. And here's Melissa. She's the OR PCC.
Hi, welcome to the operating room. I'm Melissa. I'm a registered nurse and patient care coordinator of the operating room. This is where you would go. So your partner will wait here whilst you have your spinal and once the catheter is in. And once you're all set up, we will take you into the operating room. You'll be in there and your partner will join you. This is our operating room table, and it's actually more comfortable than it looks. This is where you'll be, and your partner will be seated right here. We'll have a sterile blue drape, and everything behind the drape, you're able to move around normally within certain constraints and take photos, videos, and we can also even play music depending on the urgency of the C-section. When the baby's born, the doctor will lift the baby up and we'll drop the drapes down slightly. We try to do the delayed clamping of the cord, and that's just so that baby gets as much as possible from the placenta. From there, if baby's stable, we will move baby directly to your chest, where we can even initiate breastfeeding or skin to skin. If baby needs to go over here, we'll bring baby over to our physician, midwife, and nursing team to assist baby.
So baby will be brought to me or one of the physicians, as well as the nurses that make up the baby team. And then we do a quick assessment. Like Melissa said, if the baby is well, then we get them right over to you, usually skin to skin. If the baby needs a little bit more assistance or monitoring, then we'll keep the baby right here while we do our steps through resuscitation. Your partner is able to come and have a look, and we do welcome video and pictures during this process. Like I said, as soon as possible, we'll bring baby over to you. We do encourage breastfeeding as soon as possible, ideally within the first hour.
And from here, you can also see that you'll have a sight line from here to baby. So even if baby's over here, you'll still be able to see your little one, which is really important. If you're not able to do skin to skin time with your baby during your cesarean section, your partner's definitely encouraged and welcome to do skin to skin during that time.
All right, so once your C-section's completed, you and your baby will go to the postpartum room, or the room that you'll be staying in postpartum. Your baby will be in a bassinet. You'll go over on your bed, and I'll take you back. It might be the same room that you started with, and it might not. So everyone stays in the hospital a varied amount of time after your delivery, depending on what type of delivery you had and how you both are doing during the postpartum period. Before you go, your nurse will go through a lot of teaching with you, make sure you have a feeding plan prior to go home, breastfeeding's going well. You will need a car seat to go home. None of us are certified here to check baby's installation in the car seat or the car seat's installation in the car. Make sure you're familiar with it before you get here. Once you go home, you'll be followed up with by public health, regardless of whether I'm looking after you or your family physician. They'll come see you at home or at least call to connect. If you're one of my patients, I'll be seeing you the next day. Regardless, before you go home from the hospital, there should be a plan for follow-up once you're home. If you have any urgent concerns, this folder you'll go home with has numbers for public health, 811, and if you're truly concerned, don't hesitate to come to the emergency room with your baby. Hi, Maggie.
Hi, Hi, Tana. How's it going?
Great.
Good. Hi, my name's Maggie. I'm one of the public health nurses here in Fernie. So once you guys get discharged from the hospital, we get notified that you've been sent home. And within 24 to 48 hours, we give you a shout over the phone and connect with you and see how things are going now that you're home with your new addition. So public health nursing services offer postpartum support free of charge. So we either connect with you in the house, over the phone, or in the office, depending on your preference there. And primarily what we do at the house there is we offer lots of support around breastfeeding. We really help with latch, with milk supply, if there's any concerns around there. All our public health nurses have extra training and do an extra course around breastfeeding support. So we're well trained there. And then if there's any extra concerns, we do offer supports to lactation consultants within the community for free. In addition to the postpartum visits, we provide postpartum support around mental health, as well as nutrition support, safe sleep, and just general resources within the community. Come on and follow me into the health unit, and this is where we do our baby well clinics. So this is the office, one of the offices of the public health where we do our baby well clinics. So those start at 2 months of age. At the Baby Well Clinic, we offer immunizations, as well as we offer information around infant development, as well as behavior. We also talk about safe sleep, talk about feeding, nutrition, all those questions that you may have with a new little one while you're growing with your family. In addition to that, we provide referrals off to external service providers as needed. So whether that be lactation consultants, as I mentioned earlier, infant development, audiology, or any concerns or curiosities that you might have. We're also available Monday through Friday, 8:30 till 4:30, through the phone if you have any questions or concerns. And we're happy to come to you if you need extra support at the home anytime. Keeping in mind, we do have a scale and weight scale in the front, and you can drop in anytime you'd like, Monday through Friday, if you want to use that at any time you'd like. We really look forward to seeing you at your new journey postpartum. Keeping in mind, we're available Monday through Friday, 8:30 to 4:30. So don't hesitate to give us a call anytime. We are here to help you.
So I often get asked the question about what happens if there are multiple labors going on at the same time. We have 2 rooms that are fully equipped at this hospital for deliveries and a third that can be used if needed. Even if several people deliver in the same day, it often is possible, as long as we have the resources, to move people postpartum so we can still utilize those labor rooms. Safety is our primary goal, and so it does occasionally occur, very rarely, but it does occur where we don't have the resources required to safely look after multiple people at one time, which might result in a transfer to East Kootenay Regional Hospital in Cranbrook. Those of us that work at Elk Valley Hospital looking after families having babies understand what a special time it is for you. And we know that there can be extra stresses and anxieties that can come along with planning to have your baby, especially if it's the first time, but not only if it's the first time. We sincerely hope that your time here is beautiful and that you leave this hospital with your baby and with memories that you'll treasure forever.
My name's Ashley, and this is my husband James, and our baby Carmen. She's just 6 months old.
Yeah.
Like most first-time parents, not really sure what is going to happen when you give birth. So my big thing was to lean into research. So, find reputable resources to help me understand what to expect and what my options are. So I did have the help of Tina beforehand. So you do see your medical professional, whether it is a midwife or your family doctor, ahead of time for monthly or even more frequent checks near the end. When the time came for me to give birth, I felt pretty prepared and really confident that the medical team would know what I wanted and how I wanted to be treated during the process. The long and the short of it is I wanted as natural of a birth as possible because one, you never know how many kids you're going to have, and maybe this would be my only opportunity to go through that, and I wanted to be as present as possible. I knew some of the pain relief options would take that take sensation and even awareness away from you. So I wanted as, natural as possible. In the birth plan, though, I did have some that were pretty low in terms of the invasiveness. And those options were given to me. I did try to use them, but I realized I didn't need them. So yeah, ended up in that sense getting exactly what I wanted, a pretty natural birth. But I remember going to the room, being so ready to give birth. I just took off all my clothes, and there's all of the nurses descended on me and hooked me up with the IV. I got my second dose of the antibiotics, and then I know Tina was on her way. So we kind of just held tight for the antibiotics to be delivered. And yeah, I just kind of told myself, wait for Tina, don't push through the contractions. Yeah. So Tina came, she checked me. It was 10 centimeters, so I know I was ready. I remember the room being really hot, and I don't know if that was a normal, regular thing, but if I needed a cool cloth, that was provided. And yeah, when I wanted the nitrous oxide, even though I eventually didn't use it, that was provided as I needed it. So yeah, it definitely felt like the room was big enough that I was able to get all the resources, but I wasn't feeling cramped or hovered with all the people trying to help me. So for me, near the end, it came to a point where I was just exhausted. And when finally gave that final push and Carmen was born, I remember being in shock. I was like, oh my God, I did it, and we have a baby. And I remember saying over and over again, we have a baby, we have a baby. And James was like, yeah, we have a baby. And yeah, I think we were just wow, this is, we've entered that next stage of our lives. We're no longer just a couple, we're now parents of this child. The nurses knew exactly what to do with me being in the condition I was, and were really helpful. Even post-delivery, when they come in and they check up on you and they check up on the baby. They were really great, really informative. And then when we left, they made sure, all of our questions were answered, and we knew what resources were available to us if we had any more questions and we'd already left the hospital. So no, it was really great.
We've got Brent and Malia, who is just about 2, and then baby Carter, who's a month and a half old, and myself, my name is Jess.
So I was fortunate to have both my babies delivered at the Elk Valley Hospital in Fernie. Our first was delivered by an emergency C-section, and my second was delivered by a scheduled C-section. So I guess you can say I'm pretty well acquainted with the operating room at the Elk Valley Hospital. Emergencies do happen, and I would say in my case, I labored and everything, it just didn't eventuate in the end. And I would say comparing the two from an emergency to a schedule, the procedures was both seamless, exactly the same. It's just kind of the beginning, how you approach, how it's determined from going from labor into an emergency C-section. And then with a scheduled C, it was completely different. Everything was well organized. You were prepped and primed on the beforehand and on the day. You pretty much had a really good idea of your medical team that were going to be there on the day. Two similar but very different situations. In terms of my stay at the hospital post-treatment, I would say I was basically treated like royalty by the end. Of course, the nurses and the doctors, they have their routine checks. They come in and check on you and baby throughout your stay. But what I really recognized out of those moments with the staff and the team were that they really cared. And you could just tell that they love what they do. And that to me stood out. Your every need was their main focus. And I think that's why I felt very fortunate to have both my children at the Elk Valley Hospital. Brent was there with me, and I also had a doula for my first pregnancy too. So it was really, I felt fully supported by the hospital staff, as well as my support team that I had with me. And beforehand, I had done a lot of like prenatal prep. Not only just through the doula services, but the public health offered a lot of prenatal guidance. And at the time, in the heat of the moment during labour, when it was decided upon that it was time to do an emergency C, everything that was kind of being thrown at me, or the scenario that was going to take place, I felt really calm and also supported by everyone in the room. But I knew from all my pre-education that what was going to happen from there onwards. Morphine. There was a lot, actually. There was like morphine, nitrous oxide. Then I ended up having a epidural. That was with the first pregnancy. The second, it was just straight up the spinal, because it was scheduled, so they had all of that organized, yeah. And then afterwards, you like postnatal, you're treating with just your Advil and Tylenol for almost up to like a couple weeks after your treatment or after your surgery. Besides like the doting medical team, I would say the medical, like the maternity ward and the rooms that we stayed in, they were very private, and you almost felt removed from the chaos that can be associated with the hospital. So our first few moments as a family, we were able to be in a calm, peaceful and private environment. It's nice, yeah.